Namaste and welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Annavasvatas Vyadi and we have discussed Udarashul in the last lecture. One point I forgot to mention, which is very important as a hetu regarding Udarashul, is consumption of dry food, Rukshanna, is a very common hetu when the Udarashul is seen recurrently. And this type of hetu is seen mainly in the lower economic class because on the world they don't carry the tiffin as a whole meals, and they most of the time they eat the food like vada pav, etc. So these such consumption of such food which is dry in nature, rukshanna, always causes as a major hetu of udarashul. As it is a major issue, I mentioned it in today's lecture. So we will move towards the next disease, which is pravahika. Now everyone know pravaha manasya pravahika, when a patient has to give strain during the mala pravritti, and that is called as pravahika. Now samprapti of the pravahika is very interesting. What is seen, what is written in the text, that Vayu Vatadosh gets prakupit, it drags the kapha dosh which is in amashay. The kapha dosh which is dragged by the vata dosh comes to the pakvashay. Now vata dosh itself is a ruksha gunatmak. This prakupit vatavayu and increased rukshata of vatavayu, this snigdha kapha gets sthana and it gets attached to the intestinal walls, mainly large intestines. Now what happens? This kapha dosh which has been dragged by vata dosh in the pakvashay is not a normal, it is the sort of the foreign body, not foreign body, but some other than normal content in the pakvashay. So what is the reaction of the body? In this kapha dosh which has been stick to the intestinal walls, the body tries to expel it out. Now in this expulsion movement, again there is vata prakop, there is increase of dryness, and this kapha dosh which is already stand gets stick to the intestine more and more, and so more the stiffness of the kapha dosh to the intestine, more are the efforts from the intestine to expel it out, and this effort results into the straining during the mala pravritti, that is pravahan. So it is all about the expulsion of the sthana kapha which has been stick to the intestinal walls in large intestines and throw it out with the forceful straining, and it is called as pravahika. Now you have to differentiate when patient says about this pravahika. There are people with the Kurokoshta which has to give strain during mala pravritti. In this patient you will always, most of the time will find the intensity of constipation on higher side, so they also give strain during the mala pravritti, and in pravahika also you will see the straining during the mala pravritti. So when a patient says to you that I have to strain during the mala pravritti, don't diagnose it as a pravahika immediately. Just rule out whether it is the natural habit of the patient because of Urokoshta and other hetu like Rukshana Sevan, list, drinking of water, etc., which we have seen during the Malavrot, when we had discussed Malavrot, or it is really Pravahika. When it is Pravahika, you will always find a major symptom along with the staining that it is the Sakafa Malapravritti. Means there is Kapha Nissaran and patient typically says that I feel that there is mucus during the defecation. So when there is constipation only, then you will not find the symptom of mucus in the malapravritti, and in pravahika patient will tell you it is sakapha malapravritti. Kapha matra vistaranam is a word which is given in the text. So these are the two main, this is major factor during the during these two types of the patient having staining of malapravritti as a common symptom. Now this samprapti, which is very interesting, that it brings that kapha dosh to the intestines. The symptoms all you know: vataja pravahika, rattaja pravahika, when the stain is more, then there is a bleeding, etc. I want to put you in front of you the question about the samprapti, that kapha dosh, which is in amashay, which is the sthana of amashay, gets dragged down towards the pakvashay. Actually, the last part of intestine is will be more specific because the staining is at that portion. My question in front of you, firstly, that what is the why this kapha dosh gets dragged down so easily towards the intestine? First thing, and sub question about this, from amashay to pakvashay, or even last part of intestine, there is a grahani or small intestine in between. So why this kapha dosh doesn't get stick to the grahani area, which is immediate to amashay, or the small intestine part, which is the further portion of the annava srotas? Why it ultimately reaches pakvashay without sticking into the laghvantara or small intestine? And this is the between the lines of the samprapti. See, I might try when I discuss any topic, I will not discuss those points which you can read in the books or which you have already read in the books, because it is easy. So I never go with the symptoms of or types of vataja pravahika, pittaja pravahika, kaphaja pravahika, or types of these types of any other of disease so far. So I will talk only those things which are not written in the text, and which is I will put my logic in front of you, and your answer is expected or your thought is expected. So I will conclude today with this question: why this kapha firstly comes down, though there is vatavarako, what drives pittam pangu. See, pittam pangu, kapham pangu, pango manatava. This is the classic example, pravahika samprapti, that vayuna itra niyante. So vayu drags them to any part of the body, and this is the example that this kapha dosh, which is present in the amashay, gets dragged down by vata dosh. So that's why pittam pangu, kapham pangu is this stanza is exactly suitable for this pravahika, firstly. And secondly, why it doesn't get stick to the laghvantara or grahani, small intestine, whatever you say. So we will discuss these two topics in the next lecture. Thank you very much.